Assalamu alaikum. Our lecture today will be about immunodeficiency. By the end of this lecture, you will be able to define immunodeficiency. What is immunodeficiency? What do we mean by immunodeficiency? And to describe common presentation and types of immunodeficiency, and to discuss immunological basis for each type of immunodeficiency. Well, immunodeficiency, and if there is deficiency or there is problem in the immune system. So immunodeficiency is a state in which the ability of the immune system to fight infectious diseases is decreased or entirely absent. The main function of the immune system is to attack or prevent infection, okay, or defense against infection. Immune deficiency is loss of the ability of the immune system in fighting infectious diseases. So usually patients who have immune deficiency present with SPUR. SPUR is abbreviation for S for severe infection. Patient with severe infection, we have to suspect immune deficiency. Persistent infection. If there is persistent infection, this is we have to put in mind immunodeficiency. And unusual infection like pneumocystis carinii. It is pneumocystis carinii and recurrent infections. So if patient have severe, persistent, unusual or recurrent infection, we have to put immunodeficiency in the differential diagnosis of these infection, okay, or in this case. Right. Patients with immunodeficiency are more susceptible to autoimmune disease and malignancy. Okay, we know that the T cell, CD8 T cell, have a role in fighting and destroying the malignant cell. So when there is immunodeficiency, our patients with immunodeficiency are susceptible to the malignancy. Also, they may have autoimmune diseases. There are two types of immunodeficiency disorders. Immunodeficiency, either primary immunodeficiency or secondary immunodeficiency. The primary immunodeficiency usually present at birth and it is due to genetic disorders that usually hereditary. So primary immunodeficiency is a genetic disorder, okay, and usually present at birth. Sometimes may occur in later life, but usually it is occur at birth and it is due to genetic disorders. Secondary immunodeficiency is disorders that develop in later life and often it is acquired. It is a result from drugs or another disorders like diabetes, like HIV, and it is more common than the primary immunodeficiency. So secondary immunodeficiency is acquired and it is caused by another disorders or another caused by certain immunosuppressive drugs or another disorders like HIV infection and diabetes, and it is more common than secondary immune deficiency than primary immune deficiency. And the most causative infectious agent, and well known, is HIV. HIV is the virus that cause secondary immunodeficiency type. If we compare primary and secondary immunodeficiency, the primary, okay, it occur from intrinsic defect. It is due to genetic defect. But in secondary, there is underlying disease or use of certain drugs, as I said. And in the primary, usually sometimes there is missile type. Also, it may be due to non-functioning component. So there is the component of immune system is present, but it is non-functioning, or sometimes there may be missing enzymes. In the acquired immunodeficiency, or secondary immunodeficiency, it's usually acquired secondary immunodeficiency, and the underlying disease may be lymphoid malignancy, and it can occur due to infection like HIV. Malnutrition can cause secondary immunodeficiency, and immunosuppressive drugs. Okay, primary immunodeficiency, there is a lot of categorization of immunodeficiency or of primary immunodeficiency. We use this. Primary immunodeficiency have 4 types. Either primary immunodeficiency due to defective maturation of lymphocyte. Defective maturation, so there is no mature lymphocyte. Okay? Or defect in the activation of lymphocyte. There is lymphocyte, but it is not functioning. Okay? And defect in the innate immunity, and lymphocyte abnormalities associated with other diseases. So other diseases, rather than immunodeficiency, associated with lymphocyte deficiency or with immunodeficiency. Okay, first we start by primary immunodeficiency due to defect in the maturation of lymphocyte. So there is no mature lymphocyte, and these are 3 diseases. Okay, either severe combined immunodeficiency, okay, and X-linked A gamma globulinemia, the proton disease, or Digeorg syndrome. So primary immunodeficiency due to defect in lymphocyte maturation, no mature lymphocyte, 3 categories or 3 diseases. Okay, the first one is severe combined immunodeficiency, and the second one is X-linked A gamma globulinemia, and the third one is Digeorg syndrome. We will go through them one by one. Okay, severe combined immunodeficiency. There is abnormality, or in which there is abnormality in both B and T. The abnormality in both T and B lymphocyte and lead to severe form of immunodeficiency. So there is no mature B or T lymphocyte, and NK cell also deficient. So from this name, it is severe combined, severe presentation, can lead to death, okay, or lead to death. And combine both cell types or lymphocyte, T and B lymphocyte are deficient, and sometimes NK cell also deficient. Okay, immune deficiency. And severity of the disease because of 2 arms of adaptive immune system are involved. Humoral and cellular arms are involved. So all types of infection are present. Intracellular microbes and intracellular microbes can infect the patient that who have severe combined immunodeficiency. And the patient presented early in childhood with failure to thrive, and infection can be severe and fatal. Okay, this is child putting in a capsule for protection. Okay, and unfortunately he died later after bone marrow transplantation. This is the also the baby, some inside the capsule or inside the jacket. Okay, the second one is X-linked agammaglobulinemia. Agammaglobulinemia, so it is problem in the P lymphocyte. So it is disease affect B lymphocyte maturation in the bone marrow, and it is resulting failure of B cell to produce antibodies. So its name agammaglobulinemia, and it's X-linked, so it affect mainly the male, or if it affect the male in early childhood, and patient present with severe recurrent bacterial infection. There is defect in the humoral part of the immune system, so there is recurrent severe recurrent bacterial infection. يعني في الاكس لينك اي جاما جلوبولينيميا في مشكله في الماتوريشن بتاعت البي لينفوسايت، and بالتالي ما في انتي بوديز. البيشنت هو دايما بيكون ميل، والميل ده دايما بيجي بسيفير بكتيريال انفكشن، بيكون عنده بكتيريال انفكشن لانه المشكله في الهيومرال arm of adaptive immune system. And the most common organism are extracellular organisms, mainly bacteria, due to defect in the humoral immunity, as I said. Okay, and treatment of this disease is by I give them immunoglobulin replacement، يعني اديهم immunoglobulin جاهزة، اديهم antibodies جاهزة، and stem cell transplantation. I do transplantation of the stem cell, okay, or bone marrow transplant, and gene therapy. It is due to genetic disorders, so I can do gene therapy. Okay, type. And the third disease or the third syndrome in the defective maturation of lymphocyte is Digox syndrome, which is the disease of the T cell maturation. Okay, and it is due to incomplete development of thymus gland. Okay, so there is problem in the thymus gland, and you know that the T cell originates from the bone marrow and differentiated in the thymus. So when there is problem in the thymus, or there is incomplete development of the thymus, the T cell will not differentiate it. And also this disease in Digox syndrome, it is associated with incomplete development of parathyroid gland. There is problem in parathyroid gland, so patient have hypocalcemia because there is no parathyroid hormones. Okay, you know that in no parathyroid gland and the thymus come from the same embryonic arch، يعني from the same embryonic in the embryological development, it came from the same arch, or it came from the same side. So when there is incomplete development in the thymus, there is incomplete development of parathyroid gland. يعني العيان بيجي بشنو؟ بيجي بفيتشرز بتاعت hypocalcemia. Okay, and the clinical feature of Digox syndrome is hypoparathyroidism. Hypoparathyroidism. There is low level of parathyroid hormone, cardiovascular defects, and abnormal faces. Usually they have abnormal faces. Okay, and this is patient of Digox syndrome. This is the face of patient with Digox syndrome. Okay, so these are three types of defect in lymphocyte maturation: either severe combined immunodeficiency, in which both T and B lymphocyte are deficient, and the second one is X-linked agammaglobulinemia, which is defect in the B lymphocyte, and Digox syndrome, which is problem in the T lymphocyte. So this is the defect in lymphocyte maturation. نجي للسكند type is اللي هو defect in the activation of lymphocyte. إنه there is problem in the activation of lymphocyte. There is lymphocyte, but it does not do its function. Okay, so there are four diseases or four syndrome. The first one is X-linked hyper IgM syndrome, and the second one is selective IgA deficiency, and the third one is chemovariable immune deficiency syndrome, and the third one is Behr lymphocyte syndrome. Okay, these are four syndromes: X-linked hyper IgM syndrome, selective IgA deficiency, common variable immune deficiency, and Behr lymphocyte syndrome. طيب, X-linked hyper IgA syndrome, it is due to failure in the isotype switch from IgM to the other type of immunoglobulins. دايما the first immunoglobulin that synthesized is IgM. كويس. البي ليمفوسايت لما تيجي تصنع الاميونوجلوبولين اول واحد بيطلع هو الاي جي ام. بعد ذاك بتحصل عمليه اسمها كلاس سويتشنج يعني the B lymphocyte is switch from synthesis of IgM to another isotype of antibodies. Okay, and in X-linked hyper IgM there is problem in switching of from IgM to another antibodies. So this lead to excess of IgM and decrease in other type of immunoglobulins, like because there is deficiency in IgA and in IgG and in IgA and E and G. Patients are males because X-link, and patient present with recurrent bacterial infection. Okay, so بالعربي كده الاكس لينك هايبر اي جي ام قلنا ايه؟ طيب selective IgA deficiency, it is the commonest primary defect of a specific immunity. So the commonest primary immune deficiency is selective IgA deficiency. Most patients are diagnosed incidentally, so it is asymptomatic. Selective IgA deficiency is asymptomatic. Most patients present incidentally or diagnosis incidentally. They are healthy. And it is predisposed to individual to variety of disorders, particularly celiac diseases. بيكون عندهم gluten sensitivity. يعني those patients with selective IgA deficiency usually they are healthy and they will be discovered accidentally. Okay, and usually they are predisposed to gluten sensitivity, to celiac diseases. طيب اللي هي حساسية القمح. يعني الناس اللي عندهم IgA deficiency أول حاجة IgA deficiency ده هو الموست common type of immune deficiency. يعني أكتر type بيجي عند الناس هو selective IgA deficiency. لكن الميزة اللي فيه إنه البيشنت بيكونوا healthy، يعني ما الزول بيكون ما عنده أي حاجة، كويس عايش، ما عنده حاجة ظاهرة يعني كويس. بيكتشفوه بالصدفة. كويس. ودايما البيشنت اللي بيكون عندهم selective IgA deficiency ممكن يكون عندهم gluten sensitivity، عندهم حساسية القمح، عندهم celiac diseases. Okay. طيب common variable immune deficiency, these are group of diseases characterized by decrease in the level or the function of IgA, IgG and IgM. So there is problem in the function or the level of IgG, IgM and IgA. This is common variable immune deficiency. يعني هي common وهي variable، هي common presenting. Okay, common presenting، لكن ما لا نحن بنشوفها في قلنا selective IgA deficiency البيشنت بيكونوا healthy، لكن common variable immune deficiency it is common. Okay, common with presentation. Okay, and it is وهي variable deficiency in the level and in the function of the IgG, IgA and the IgM, and these are the commonest form of antibodies deficiency اللي هي symptomatic antibody deficiency. The commonest and symptomatic primary immunodeficiency is common variable immunodeficiency. Okay, تمام. So and the last disease is Bare lymphocyte syndrome, in which the disease is characterized by loss of MHC class 2. بما إنه في loss of MHC class 2, so there is defect in the function of the CD4 cell. Okay, loss it does not recognize the antigen and it does not activate it. The T lymphocyte does not recognize antigen and it does not activate it. So usually patient present with viral infection اللي هي intracellular infection. وقبل ما نمشي للديفكت innate immunity نشوف تاني أو نعمل to summarize the defect in the activation of lymphocyte. قلنا there is lymphocyte لكن في مشكلة في الactivation بتاعتها، يعني في مشكلة في الانتيبوديز أو في مشكلة في الفانكشن بتاعت الليمفوسايت اللي هم قلنا these are four types or four syndromes. الأولى الإكس لينك هايبر اي جي ام syndrome، قلنا أصلا بيحصل كلاس سويتش من الاي جي ام للأذر تايب اوف انتيبوديز. في الإكس لينك هايبر اي جي ام syndrome بنلقى إنه الكلاس سويتشنج ده بيتفقد، بالتالي ما في اي جي جي، بالتالي ما في اي جي اي، بالتالي ما في اي جي ام. اوكي، و هو اكس لينك يوجوالي بيكون عند الميل، اوكي، وبيجوا ببكتيريال انفكشن. السلكتيف اي جي اي ديفيشنسي الثاني اللي هو السلكتيف اي جي اي ديفيشنسي ده قلنا الكومنست فورم اوف برايمري اميون ديفيشنسي، لكن يوجوالي هو ماله اسيمتوماتيك، يعني العيان انا ما بكتشفه الا بالصدفه دائما او في الغالب في حاله البلود ترانسفيوجن. اوكي طيب انا بكتشف العيان بالصدفه انه العيان ده عنده سيلكتيف اي جي اي ديفيشنسي، وبيجي في الليتر لايف يعني بكتشفه في الليتر لايف and patient with selective IgA deficiency ممكن يكونوا هم predisposed للسيلياك ديسيز اللي هو حساسية القمح، ممكن يكون عندهم سكين راش and so. الديسيز الثالث اللي هو الكومون فاريبل immune deficiency هو هو الكومونست سيمتوماتيك برايمري immune deficiency، وهو مشكلة في الاي جي اي والاي جي ام والاي جي جي، في مشكلة في these antibodies وفي الفانكشن بتاعتهم، ممكن يكون مشكلة في الفانكشن، ممكن يكون مشكلة في الليفل بتاعهم، يا اما الليفل بتاعهم لو يا اما الليفل يا اما هم قاعدين لكن هم ما عندهم الفانكشن بتاعتهم فيها بروبلم. الديسيز الرابع اللي هو البير ليمفوسايت سيندروم. في البير ليمفوسايت سيندروم قلنا في مشكلة في الام اتش سي 2، في loss of expression of MHCC2. المشكلة في loss of MHCC 2 بيكون في مشكلة في الاكتيفيشن of CD4 lymphocyte. اوكي نمشي للديفكت in the innate immunity. They are two components of innate immunity are affected, either phagocyte or complement system. اوكي طيب phagocyte abnormalities، نشوف الفاجوسايت abnormalities. The first disease is chronic granulomatous disease. Chronic, it is chronic granulomatous in which there is granuloma. Okay, so it is deficiency in the oxidase enzyme في مشكلة that kill the organism after engulfment. So many macrophages and neutrophils are accumulate to the site of the infection without killing the microbe, lead to formation of granuloma. يعني when the microbe enter the body, this microbe will be taken by the phagocytic cell, and inside phagocytic cell there is a lysosome which contain oxidase enzyme. Okay, so in chronic granulomatous disease there is deficiency in oxidase enzyme. This oxidase enzyme قلنا هي kill the microbe. There is deficiency in the oxidase enzyme, so the phagocytic cell will engulf or take the microbe, but it does not able to kill these microbes. So a lot of phagocytic cell accumulate and form the granuloma. So accumulate at the site infection. يعني الكرونيك جرانيوماتوس ديسيز في مشكلة في الأكسيديز إنزيم. الأكسيديز إنزيم ده هو عبارة عن إنزيم موجود جوا اللايسوسوم، بيعمل كيلينج للميكروب بعد ما يحصل فيوجن للفاجوسوم اللي هو فاجو لايسوسوم فيوجن. اوكي، لما يكون في مشكلة في الأكسيديز إنزيم ده، الفاجوستيك سيل بتعمل انجلفمنت للبكتيريا وبتكون قاعدة جواها، أو الميكروب بتكون قاعد جواها لكن ما قادرة تعمل له كيلينج. بيحصل accumulation ل a lot of phagocytic cell, neutrophils and macrophage, and it form granuloma. So it is chronic granulomatous disease. Patients are presented with intracellular organism, mainly tuberculosis. يعني واحدة من البكتيريا that killed by this mechanism via phagocytosis is Mycobacterial tuberculosis. Okay, so patient predisposed to this bacteria. The second one is leukocyte adhesion deficiency. Leukocyte adhesion deficiency. And if you remember, when there is infection or there is inflammation or there is infection as the site of the tissue, قلنا إنه ال WBCs أصلا هي inside the blood vessel intravascular، بيحصل لها بيحصل adherence of the WBCs to the blood vessel, and then it will move to the site of infection via chemotaxis. Okay, when there is defect in the leukocyte adhesion molecules, the defect in adhesion of leukocyte inside the blood vessel to the endothelium. Okay, so blood leukocyte does not bind firmly to vascular endothelium and are not recruited normally to the site of infection. يعني يكون في infection in the extracellular, but the WBCs or the leukocyte cannot move from the intravascular to the site of the infection because there is problem in adhesion of these leukocyte to the wall of the blood vessel. إذا متذكرين في الخطوة بتاعة الكيموتاكسيس زمان، أول حاجة بيحصل adhesion of the leukocyte to the endothelia، بعد ذاك بيحصل الرولينج، بعد ذاك بيحصل الكيموتاكسيس. كويس. في مشكلة في الادهيجن بتاع ال WBCs أو الليوكوسايت للإندوثيليال سيل، بالتالي ال WBCs or leukocyte cannot move to the site of the infection. Okay, and the third is one is Shidiak-Higashi syndrome. Shidiak-Higashi syndrome is defect in lysosomal granules of leukocyte. There is problem in the lysosome itself. Okay, the lysosome itself, there is problem in lysosome of leukocyte. Usually patient has partial oculocutaneous albinism اللي هم this is oculocutaneous albinism, so loss of melanin from the eyes and the skin and the hair. Okay, so this is Shidiak-Higashi syndrome. If we summarize the defect in phagocytic abnormality, these are three diseases. The first one is chronic granulomatous disease, in which there is defect in oxidase, so the phagocytic cell oxidase enzyme. So the phagocytic cell are not able to kill the engulfed microorganism or engulfed microbes. And the second one is Shidiak-Higashi syndrome, in which there is defect in lysosomal granules. And the third one is leukocyte adhesion molecules, and in which blood leukocyte does not bind to the vascular endothelial cell, so and they are not recruited normally to the site of the infection. يعني الفاغوسيتيك abnormalities هم 3 أنواع. Again, النوع الأول هو الكرونيك جرانيوماتوس ديسيز. في الكرونيك جرانيوماتوس ديسيز بنلقى إنه في مشكلة في الأكسيديز إنزيم. قلنا بعد ما يحصل engulfment للبكتيريا، أنا شرحتها إنه بعد ما يحصل engulfment للميكروب بيحصل فيوجن اوف فاجولايسوسوم، وفي اللايسوسومال انزيمز منهم الاكسيديز انزيمز. الاكسيديز انزيم ده بيعمل ديستركشن للميكروب. الاكسيديز انزيم ده بكون ما في، بالتالي الفاجوسيتيك سيل ماسك الميكروب لكن هي بتكون ما قادره تقتله، بالتالي بيتكون جرانيولوما، عشان كده اسمه chronic granulomatous disease. الديسيز الثاني الشيدياك هيجاشي syndrome. شيدياك هيجاشي syndrome ده there is problem in the lysosome. الليسوسوم ذاته absent، في مشكلة في الليسوسوم. so patient has immunodeficiency and ودائما بيكون عندهم oculocutaneous albinism. اوكي. الحاجة الثالثة اللي هي الليكوسايت ادهيجن مولكيول، في مشكلة في الادهيجن بتاع الليكوسايت، وان اصلا الليكوسايت هي بتكون قاعدة في البلود فيسل. لما يكون في انفكشن في الانترستيشال او انفكشن في حتة معينة، ال WBCs دي بتقوم بترتبط بشنو، او الليكوسايت بترتبط بالاندوثيليا، بيحصل ادهيجن، بعد ذاك بيحصل رولين، بيحصل ديابيسيس، بعد ذاك بيحصل كيموتاكسس، بتجي للسايد بتاع انفكشن. في مشكله في الادهيجن، يعني في مولكيولز او في ريسبتور ما بين ال WBCs والاندوثيليا، في مشكله في الادهيجن، بالتالي انه ال WBCs or الليكوسايت ما بتقدر تمشي للسايد اوف انفكشن. This is briefly about phagocytic defect. نمشي ل defect in the complement component. Okay, defect in the complement component are the C3 deficiency, and when there is deficiency in C3, this lead to severe recurrent bacterial infections and can be fatal. Okay, and C1q, C2 and CR deficiency, and when there is deficiency in this component, this will lead to immune complex depletion and immune complex disease. We called it lupus-like syndrome. تشبه اللوبس، تشبه الذئبة الحمراء، lupus-like syndrome. And MAC component deficiency, in which there is recurrent Neisseria infection. recurrent Neisseria infection يعني usually patient presented with recurrent meningitis, recurrent Neisseria meningitis، ده بيكون عنده deficiency in MAC component اللي هي membrane attack complex component. Okay, so the last one is immunodeficiency associated with other diseases. Okay, immunodeficiency associated with other diseases. The first one is ataxia telangiectasia. From its name, there is ataxia, so there is abnormal gait. Ataxia means abnormal gait. Okay, so gait abnormalities, and telangiectasia is problem in the blood vessel. Telangiectasia. Okay, so patient have gait abnormalities, vascular malformation, and immunodeficiency. And the second one is Wiskott-Aldrich syndrome. Wiskott-Aldrich syndrome, in which there is thrombocytopenia, اللي هي deficiency of platelet or low level of platelet, and eczema, and immunodeficiency. Okay, these are two diseases in which there is immunodeficiency with other diseases: ataxia telangiectasia and Wiskott-Aldrich syndrome. Okay. Then we go to secondary immunodeficiency or acquired immunodeficiency. Okay, the causes of immunodeficiency are either malnutrition, viral infection, and the most common infection, and the most common virus that cause, or the most common infection that cause immunodeficiency, and it is well known virus is HIV, and it causes AIDS, and اللي هي acquired immunodeficiency syndrome. Also, use of certain drugs or some drugs like cytotoxic drugs used in treatment of cancer, and immunosuppressive drugs used in transplantation. Also, radiation, when patient with cancer receive radiation or radiotherapy, this will lead to immunodeficiency. And also chronic depleting diseases like diabetes, chronic kidney diseases, cancer. Patients with chronic diseases are immunosuppressed or immunosuppressed person or immunodeficient person. So chronic disease like diabetes, chronic kidney disease, and cancer. Any question? Thank you.